Good day, Dr. Abdelgalil. Can you please introduce yourself?
Good morning, and thank you for the invitation. My name is Sara Abdelgalil, a Sudanese British doctor who works in the National Health Services. I'm based in the UK, but I'm originally from Sudan. And I work in areas in relation to health politics, as well as human rights for health access and health for all. And as your listener maybe are aware, sadly, that at the moment we are facing serious violence of extension of the armed conflict in my country. And this is why I'm here today to talk about Sudan.
All right, thank you very much. Can you describe the current conflict in Sudan and how it has impacted the lives of ordinary Sudanese people?
So since April 2023, there has been serious extension of violence and armed conflict in Sudan. There has been an ongoing conflict in certain parts, mainly in the western part of Sudan, and that's been ongoing. But currently, the extension of the armed conflict between the military and the paramilitary, the militia, Al-Janjaweed, or they call themselves the RSF, extended to the capital, Khartoum. And Khartoum has been occupied and sort of trapped in this for more than 15 months. Sadly, the degree of violence is very significant. We have lost a lot of lives. We have the largest internally displaced population in the continent and refugees in neighboring countries. But the violence did not stop in Khartoum and Darfur. It extended to central part, it's a Jazeera state, and recently to Sinnar and Sinjar, with significant degree of, killing, bombing, rape of women, looting, and threats, which affected the population in accessing health services, security, finding food. And at the moment, Sudan faces a serious, famine crisis in the next few months.
What can you say is the scale of displacement crisis in Sudan?
So the degree of the famine and serious crisis in Sudan really very high. And for us Sudanese who are still there, there's a significant number of Sudanese who are trapped, and facing the ongoing violence. Significant number moved to the relatively stable or relatively secure states, and those who have moved to neighboring countries or the diaspora like myself. We are watching, with a lot of concerns that there has been no ceasefire at all approved and no safe corridors, and therefore the limited humanitarian response by the international community is not reaching those who are in need, whether it is food, whether it's water supply, whether it's medication. And therefore, people, if they're not killed by bullets or by bombing their houses, they are killed because they are not able to get treatment and medication at time. And now there are significant loss because of thirst, of not getting safe water supply, or by not getting food. And there are reports of loss of life loss because of starvation.
Thank you for your answer, Sarah. What are the particular challenges and vulnerabilities facing women, children, and marginalized groups amidst the ongoing violence and displacement?
Women are facing, the burden of the war in different ways. They are, for example, in areas in Western Sudan, in Al Jazeera, and in Khartoum have been facing significant gender-based violence and rape cases conducted by men in uniform. And as well, they have been, sort of leading on evacuation for moving with the families. In, like, if we look at families that moved to Egypt, for example, men were not allowed because of the visa and the immigration rules that are changing every few weeks. And so women with kids and elderly entered Egypt and are trying to handle their children, their, the family needs, the health needs, without being able to work. They are not allowed or given permission to work, even if they are well qualified. And there are other issues about sort of exploitation for in labor in as displaced women to get money. There are as well reports about exploitation in areas of, apart from labor as well, sex and other very disturbing and distressing stories. With the problems with the internet and the electricity cut, the information that we are getting, it is distressing, but it is not all the facts. There are more and more to be known when people can connect and talk to the victims. Children have been suffering from the violence, from direct sort of trauma leading to amputation of their limbs, death. They are being, say, as well facing safeguarding and serious child protections issues, including as well rape of girls and boys, as well exploitation for labor, and more seriously as well recruitment as children soldiers to carry weapons, which is obviously very serious war crime. They have been facing other, hardness while they were moving and evacuating the areas with violence as internally displaced. For the last 15 months, children are not accessing education. There are issues with babies born on the move, so neonates, vaccination, the now emergence of, infectious diseases like measles and others because of the interruption of the vaccination. And sadly now the malnutrition as it's increasing and children are suffering with the complications of malnutrition. The elderly, um, of similar sort of distressing issues, and those with special needs and disability, their ability to evacuate or protect themselves, whether it's issues related to vision or mobility or hearing or being elderly, as well as accessing water supply, their medication and food. And there are ongoing research about the huge number of deaths and loss among the elderly. For example, during the evacuation, when they're reaching some of the northern border, there has been a lot of elderly who died because of dehydration and heat stroke. There have been a lot of children who have faced scorpion stings. And all of these sort of sad stories. We hear it every day. It's affecting all the families. Any family in Sudan has been affected on one way or the other by a loss of relatives, either directly from armed violence or from other types of violence, because all of these sort of human rights violation are violence in fact. If you can't access water supply, if you can't access medication, if you can't access shelter, if you can't get food, that is all in itself is one or another way of violence.
Um, Earlier, you mentioned disease outbreaks like cholera and starvation. Can you speak to the collapse of Sudan's healthcare system and the devastating impact on access to essential medical care?
So in Sudan, already the health service is fragile. Because we had long periods of dictatorship with poor governance and no investment on health services. So already we have issues and problems. And then with the armed violence and destruction of hospitals, invasion of hospitals, national laboratories, and other health facilities, that has affected the access to health. In addition, in the first and until now, some families cannot leave their houses to go for health care because they are worried they will be killed on their journey to the hospitals. In the first few weeks, there were sad stories of pregnant women in labor reaching hospital to deliver who were shot and killed at the doors of the hospitals. We have been providing telemedicine for those who can have access to the internet to answer simple questions because they can't access health services. And the invasion of the capital, Khartoum, has affected that because we know that the health service in Sudan is centralized. So by invading Khartoum and destroying the health services, this has got percussion on other states. For example, getting medication, distributing medicine, distributing vaccine, the cold chain to get the vaccination, and so forth. And therefore, the degree of death or comorbidity from not accessing health, from not getting medication like insulin, from not getting chemotherapy, from not getting early diagnosis, from increased deaths because of unsafe labor, uh, not getting medication to go for, sort of the operation like a cesarean section, and for children, assessment for asthma, for epilepsy, just sort of the daily basic care is destroyed in areas like Darfur, Khartoum, Al Jazeera. But in other states, there is an increased need. So the number of those who are internally displaced and the host communities that originally are present there, obviously this is a huge need that will require increased and escalation of health services. The situation in Sudan is very, it's you cannot determine. It's dynamic. What will happen the next, and which area will be attacked, and so the security situation is affecting the mobility of the health teams, nurses, midwives, doctors, and definitely the situation is not getting better.
How has the economic crisis and shortages of goods, hyperinflation, escalated the humanitarian situation for Sudanese families? And what are the long-term implications for livelihoods and food security?
The serious implication, there was obviously the collapse of the banking system itself and trying to get cash and money. There is the looting, the problems with security, as well the issue about the control of the humanitarian support and how it is streamed has led to a lot of corruption, a lot of issues with distribution of food and the control of its prices. And that has limited families from getting, the basic livelihood. Some families have moved to grow some vegetables and fruits on the backyard if they can. This is even should not well supported by the international community, like providing seeds or supporting the families to try to get a decent nutritional values. The medication prices